This video demonstrates how to perform a non-bronchoscopic alveolar lavage, or NBAL. Please refer to the SOP for further information on each section of the procedure. Before the procedure, ensure the patient has adequate pain relief and sedation. If the patient is awake, it may be advisable to have a second person present. You will also need to complete a closed circuit suction to remove any airway secretions before you collect your sample. For the procedure, you will need a dressing pack, sterile gloves, Y connector, 20 ml of sterile saline, 2 10 ml IV syringes, a sputum trap, and a size 14 suction catheter, or size 12 if the patient has a size 6 endotracheal tube or tracheostomy. Pre-oxygenate the patient using 100% oxygen on the ventilator. Ensure the use of appropriate PPE, including a gown and visor, and wash your hands before you start. Prepare your field by wiping a trolley with Clinell wipes, then gel your hands. Onto the trolley, you will need to open a dressing pack, sterile gloves, Y connector, 2 10 ml syringes, and a suction catheter. Place the sterile towel from the dressing pack onto the patient's chest. Use hand gel to clean your hands, and then next attach the sputum trap to the suction tubing, ensuring the suction is turned on, and place this onto the sterile towel. You can tuck this into the patient's arm if needed to help it stay still. Clean your hands with hand gel and put on disposable gloves. Then, using the manual disconnection function on the ventilator, disconnect the Y connector from the circuit and replace it with a clean one. If required, the endotracheal tube can be clamped during the disconnection to reduce the risk of de-recruitment. Now remove your gloves and clean your hands. Then you can empty 20 ml of saline from the ampules into the tray. Repeat your hand sanitisation and then put on the sterile gloves. Next, draw up the saline into the 2 10 ml syringes and leave these accessible on the trolley. Next, you need to insert the suction catheter into the inline suction port on the Y connector. Advance the catheter until resistance is felt and then withdraw by 1 centimetre. Attach one syringe to the tip of the suction catheter and occlude the vacuum tip with your thumb. Instill the saline and repeat quickly with the second syringe, angling the catheter down to ensure the saline is fully instilled. At this stage, you may experience leakage around the catheter. The sample should not be affected by this, and you should still acquire an adequate sample. Quickly remove the syringe and attach the sputum trap to the suction catheter. Keep the sputum trap upright to prevent loss of sample. If no sample is collected at this stage, the procedure is abandoned. Once the sample is obtained, remove the sputum trap from the circuit and connect the suction tubing to the suction catheter. Withdraw, applying suction throughout. Ensure the sample is sealed with the lid and labelled appropriately. You can reattach the old inline suction catheter or replace with a new one if it is due to be changed. Once the procedure is completed, you can complete a closed suction as normal and wash your hands. Reassess the patient's observations and ensure their FiO2 is returned to baseline settings.